For our professional educational teaching video, we will be presenting on the strict overhead press. As for our learning objectives for this video today, we would like you to understand what the strict overhead press is, understand how to perform the exercise correctly, where it's used and why, and variations and regressions and modifications. By the end of this video, you will learn how to execute this exercise safely, some common mistakes and safety tips to correct, and teaching and coaching tips for coaches, athletes, and healthcare professionals. Now getting into the overview of the strict overhead press. Overhead press is a full-bodied compound exercise. The arms and shoulders press the weight overhead while the legs and trunk stabilize. This is prescribed in athletic, recreational, and rehabilitation settings as a means to build healthy shoulder and arm strength. As long as it is instructed and observed correctly, anyone can benefit from the specific skill or variations of it. Why we would perform the overhead press is because it's a practical skill that is beneficial for any athlete, especially overhead athletes. This exercise builds strength and the shoulder girdle musculature. And now getting into the muscles responsible for the overhead strict press. The target muscles include the anterior and middle deltoids. The synergist muscles include the supraspinatus, pectoralis major, triceps brachii, anconeus, serratus anterior, upper and lower traps. And the stabilizers include the abdominal muscles, rotator cuff, and levator scapulae. During the pre-positioning phase of the lift, we're going to hold the bar right in front of the shoulders. Hand placement should be narrow and in front of the shoulders as well. Forearms vertical and wrists neutral. Keep your feet hip-width apart. Contract leg muscles, core muscles, and engage upper back. Inhale while driving through the floor. Press the bar overhead, keeping a neutral spine. Keep the bar close to your body. Lock out your elbows. Hold the bar above your head, feeling the weight evenly distributed between the shoulders and the feet. Then shrug the shoulders to engage the traps. Now, slowly lower the bar back down to your shoulders, returning to the beginning position, and exhale.
Here are a few safety tips. Practice movements without weight, either with an empty bar or PVC pipe. Have a spotter if you're going to go up in weight. Ensure you warm up properly, using different shoulder movements and devices. You can use a mirror or record yourself to ensure proper form. You should also stop if you are fatigued. If you experience signs of pain, that can be an indicator to modify the exercise or to stop if the pain does not subside. If pain continues, you can see an orthopedic specialist if injury is suspected.
Some regressions and modifications include using a shoulder press machine, a cable machine, dumbbell half kneeling presses, standing dumbbell shoulder presses, and split stance overhead presses. Some variations of the overhead press include the push press, the clean and press, and behind the neck presses.
A few common mistakes and errors include improper pre-positioning and lack of maintaining proper position throughout the movement, inability to raise arms directly overhead, bar moving away from the body, using legs for counter movement, bent wrists and hyperextension of the thorax.
These common mistakes can lead to compensation, improper movement mechanics, and injuries. A common injury with overhead presses include impingement syndrome, which is the compression of either the long head of the biceps tendon, the supraspinatus tendon, or the subacromial bursa. There's a decrease in space where structures become inflamed under the acromion process. This can throw the joint and its associated movements out of whack. Other general aches and pains include low back pain from hyperextending during the lift, neck pain from posture deviations. You want to ensure a neutral neck during the lift. Faulty grips can cause wrist pain. Holding the bar mid-palm causes weight to push the wrist backwards, while holding the bar in the base of the palm closest to the wrist and thumbs ensures proper wrist positioning.
Coaching cues include spreading the floor with your feet, push through the ceiling, keep your biceps by your ears, lock out at the top, keep a tight core. Practical implications for the overhead press are that it can help to improve core strength. It is beneficial to improve other lifts such as the bench press, which utilize the same large muscle groups. In developing greater strength in your upper body, it translates to greater overall ability to produce power. The overhead press translates directly to many sports that require great strength for overhead movements such as basketball, football, specifically the quarterback, baseball, soccer, swimming, and tennis. By strengthening overhead muscles, you are able to avoid hyperextension and also incorporate strengthening core muscles such as the erectors, obliques, rectus abdominis, and deep core muscles.